the Mental Health Data Prize is an initiative between APHRC and Wellcome, or formerly Wellcome Trust. And really what it's trying to do is to elevate the discourse around mental health on the African continent and how mental health disorders affect young people, and trying to see whether within Africa there are solutions that can be grounded in good science, but also supported by the technologies that have emerged when it comes to data science. And so it is bringing mental health and data science together. And the idea is to form teams that are made up of mental health practitioners, researchers who do other things, data nerds or data scientists or innovators, people with lived experiences, and everybody who is involved in mental health, and trying to bring them together and give them resources that allow them to develop solutions of things that are of the utmost importance to young people when it comes to their mental health.
How will the Wellcome-funded prize contribute to reshaping the mental health landscape in Africa?
The Mental Health Data Prize, I think it will contribute to shaping the mental health landscape in two different ways. The prize itself is quite interesting and transformative, because it's not every day that a scientist on the African continent receives £200,000 to do something. It's not every day that people with lived experiences participate in developing solutions for themselves. So the prize itself is designed in a way that beyond the prize, I think it's a different way of science, of doing science, that it is science that is participatory, it is science that brings in different stakeholders, and hopefully it's science that comes up with solutions which are likely to be successful. We are trying to build a movement because mental health scientists, mental health researchers are not that many on the continent, and a lot of the mental health is within healthcare facilities. And so the capacity strengthening sessions are building a community of practice. As I've said, so far, we've had more than 2,000 participants in the sessions, and we expect that by the end of the 5 months, maybe if those 2,000 people stay and they go through the whole 5-month training, their capacity is going to be greatly enhanced, not just from understanding different parts of this prize, but also the understanding that mental health is something which needs to be tackled by people with different disciplinary backgrounds.
In some places in Africa, a lot of time people talk about witchcraft, or they do not really understand that one condition may be linked to a mental disorder. So talk to us about culture and how it will be taken into consideration.
Different cultures treat mental health differently, especially from the seeking solutions. But witchcraft as a cause of mental health is quite dominant in many cultures. So that's actually a good thing, that there's some kind of uniformity when it comes to the understanding of the origins of mental health. So that's one part. The second part, culture is also different. It's about the things we do over and over and the things that are considered norms. And these could be things in terms of the place of alcohol, for instance, the place of drug use, recreational drug use, the place of violence in different culture, and how children are socialized. It's about isolation and how isolation is looked at. It's about whether there are practices within different communities that result into isolation, and it's about stigma, how mental health is stigmatized. So all these are differences in different contexts that can actually influence the driver, but also the potential solutions. And then I think the last part is about care seeking. So when you talk about culture as well, the understanding of communities about the origins influence their care-seeking behaviors. So as I've said, if you're able to get small data sets from different contexts, and if you have underlying data that explains, for instance, the drivers, then it's possible to see whether countries with similar context of the drivers, but not of the magnitude, whether it's possible to assume and extrapolate about the potential magnitude about that. So we expect that we'll have projects that perhaps will give us a better sense with much more robust estimation tools, a better sense about the magnitude of mental health, about the differences in cultural beliefs, the differences in things like stigma, but also the differences in care seeking.